bought that toy, but you had to buy that toy to get them out of the store because they're too big to pick up, or you just were so uncomfortable of all those people staring at you, you had to get out of it, right? You did it, don't beat yourself up, but learn from it. How can I prevent that from happening next time? So there is survival mode. Believe me, I've had to do things like that. It is what it is. But you want to try to learn and prevent it next time. And I love this phrase. This woman, Barbara Haas-Givler, she's another board-certified behavior analyst in Pennsylvania. And this is her big, she used to work in Elwyn homes for people with Prader Willi syndrome. She knows a lot about it. She's phenomenal. Her message is respect the Prader Willi syndrome. And I just think that's perfect because you have to respect it and take into account in order to make your changes behaviorally. So I want to talk a little bit about the difference between what a behavior specialist is and what a behavior analyst is, because there are some pretty significant differences that people don't know. So a behavior specialist is just kind of somebody who has a job that's going to help with behavior. In some states, in order for insurance, there are some criteria that you have to be a licensed behavior specialist, but that criteria in most places it's not very high, and it's nothing compared to what you have to do to become a board-certified behavior analyst. So as you can see, it's kind of just generic. You have to have some experience with kids and behavior, and you can call yourself a behavior specialist. Behavior analyst is, you should want to see those BCBA behind their name. It means board-certified behavior analyst. It means you have at least a master's degree in a related field. We've completed specific grad courses in applied behavioral analysis. We've completed, it's close to like 2,000 hours of supervised field work in behavior analysis, and a lot of that was sitting down with a supervisor, answering your questions, critiquing you, making sure you're doing it right. Then you have to take and pass a board exam, which is no fun, and it's the same criteria across the world. So BCBA in the US is the same as one in Canada, is the same as one anywhere. It's all the same criteria. And if there's a D behind it, it means they have a PhD, but the rest of it's pretty much the same. And this BACB.com is the board that is the certifying board. So if you ever have, information, and you can go on that board and search for local BCBAs near you. So how can ABA principles be used? So like I said, the beauty is that it's flexible. So in a school, there's a variety of ways. You can be in an ABA classroom where they're really intense and they're doing this one-on-one work and they're taking data and they're doing their work and there's a BCBA in there. It could also be that your student's in a gen ed, your child's in gen ed all day, and there's like I consult. So there's a board-certified behavior analyst that observes and gives tips to the teacher on how to kind of tweak their teaching with behavior analytic techniques to make sure the student's really learning the best way. Your student could have a behavior support plan. Should be written by a BCBA, but it doesn't have to be. They could go back and forth between like special ed or regular ed and ABA classroom to get some of that. Their one-on-one could be a registered behavior technician, which just means that they went through about 40 hours of coursework from a BCBA and they have more knowledge than just a general one-on-one. Out in the community, you could have like a traditional home program where you have a provider that comes to your house, works with your child so many hours a week, and a tech works with them. The BCBA supervises a couple times a month, and they take the data, and it's very systematic. But they should be giving you training so that they're telling you what they're doing so you can do it when they're gone. You as a parent, because it is really hard, I couldn't get in-home ABA services for my own child until a year ago. Like, it wasn't possible. I do it for a living, I do it for other people. I couldn't get it for him because of insurance, because of the state, because of everything. So you can use these principles, you can use this ABC just throughout your life. So that's where I'm saying you don't have to be in an ABA program to be using the ABA philosophy throughout the day. You could possibly, because if your insurance doesn't cover, you can't get it through the state, it's not a cheap service if you're paying out of pocket. But you could possibly maybe have just the BCBA come, if you feel like you're pretty involved, you just need a tip here or there. Maybe somebody could come once a month or twice a month and just kind of sit with you as a parent and do some parent trainings. And then there's some clinic programs where you just take your child to the clinic and it's like what you do in the home, but it's just in a clinic. So what is a functional behavior assessment? So it's a systematic way of isolating those antecedents and those consequences. So the point of an FBA is to figure out the function of behavior. And then we create a plan. So in the law, school districts are required to do FBAs under certain circumstances, and not everybody realizes this. So some of the circumstances or the factors to consider is, if a child does or doesn't have a disability, if they've been removed from school for more than 10 days, an FBA needs to be done. If there's any behavior that involves, serious bodily damage or weapons, you need to do an FBA. They're often done if you're looking at moving into a more restrictive setting. You'll do an FBA first to see if you can do it where you're at. Parent permission is required. It is required to do an FBA. The language in the law is very general. Anybody can do one. They just have to have training. That's it. Legally speaking, a teacher can conduct an FBA, a school psychologist. If you can get a BCBA to do it, we just have a lot of training in that, and that's ultimate, but it's not your legal right. But what I'm going to show you is what an FBA should look like. So you might be in a school system that you get an FBA done, and it's the teacher or the school psychologist. Yeah. Mm-hmm. No. That's like the first time, really. I should clarify that. So if you have an active behavior plan with an FBA and like aggression and injuring others is known. If there's not one in place, oh, yes. For the initial, yes. When it starts happening, yes. You should get one done. That's a reason when they should consider it. And yeah, it's a reason to ask. And when you ask for one as a parent, so when you request, Tony's going to go through that. I don't want to steal. But when you request one, it initiates the reevaluation process. So in writing, you request for an FBA. Within 10 days, they need to respond to you with a yes or a no. And that yes would be the form that you sign for the permission. And then they have 60 days it depends on your state, but you have about 60 days to do it. And then about another 30 to write the IEP based on that. So if you get an FBA and you're not sure if it's good or not, I want you to use this checklist. So the behavior should be clearly defined. There shouldn't be any emotion words when those behaviors are defined. You should be able to see it, and everybody should know what they are. There could be an interview with teachers and parents. You want to identify strengths and weaknesses. You want to find times of the day this happens. Anything that can help the assessment tailor to really look at what's going on. Then there's actual data. There needs to be numbers. There needs to be graphs. You can use some rating scales where teachers fill out it happens at this time of the day and you get an idea on function. But if I didn't see it, it didn't happen. That's basic philosophy. There needs to be actual hard data. This behavior across 3 days occurred 17 times, occurred 2 times. You need numbers. That is super important. Then you use all of that information, you look for trends, you find the function, there should be a hypothesis statement that has the setting, the behavior, and the maintaining function. And one behavior, this is what's really important, and I'm always surprised still, even when I find this, when we do these assessments, one behavior can function for multiple reasons under multiple circumstances. This is why FBAs are so important, because we're looking at the environment. Behavior is based on what's going on in the environment. So at one point, there could be a certain person that always gives attention for inappropriate behavior. So when I take my data, I find out that this student only hits people. There's only one person that student hits. It's one specific assistant, and everybody could have guessed it because that person is always like touching them, giving them attention. So we know in that situation, they're hitting that person to get attention. So we're going to intervene based on that. But when they're given the math worksheet, then they want to escape the work. So in that situation, we're going to have a different intervention. We're going to maintain the work versus teach them how to get attention. So it's super important for that. And then there should be recommendations for intervention. So the whole behavior plan won't be written there if they think it's significant and requires a plan. And the interventions need to be based on function. And they shouldn't be all 4 functions. I can't tell you how many times I inherit students and it says, this student engages in hitting in order to escape and get attention and maintain sensory intervention. And I'm like, I don't know what to do. Like, I need more information. So if you're seeing statements that have one behavior and like 2, 3, 4 functions, you need to come back and say, you need to do this again. So this is where your school's going to do it. And if it's a good one, then that's awesome, because definitely schools can do good ones. I think my schools do, hopefully, do good ones. But you can use this to say, you know what, you're missing this, 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 and this. I want to request an outside eval. I need you to contract a local BCBA to come in and do this. And you have your framework for it. You're not just a parent saying, I think I want more. I want to cause trouble. You have your reason. And then you create the positive behavior support plan from that. So these are some good resources. So obviously we all know Elizabeth Roof. So Barbara Haas-Givler is who I referenced earlier. Her thing is the genetic underpinnings of behavior. She works at ADMI Geisinger in Pennsylvania, which is where I'm from. And she does offer this website. The Geisinger offers consultative services. And they do Prader Willi, like they'll do child specific, they'll train school staff, or they'll observe the child and things like that. So they can help with that. People have probably heard of Dr. BJ Goff. She's up in New England. She's a very good resource. Pittsburgh Partnership. That's an excellent website. I print off a lot of their papers when my son goes to new places because they have really good handouts about just the genetic piece and the brain piece and just keeping things low. So I really like them. Behavior Babe is an ABA website. So it's not a Prader Willi site. It's a really good ABA site that's very parent friendly. They've got a blog. I pulled some of my information from here. The Rights Law one is a quick, like, what is an FBA? It's a very parent friendly, what is it? How should it be done? It's a nice little thing. And then this last little one is called selfandmatch.com, which is it's an evidence-based self-monitoring system. And it's just a good website to go and get an idea of, what is self-monitoring? How does that work? And it's research-based, and I shared that website with my son's school, and they ended up bringing those people in, training the entire district, and they now use this in their school system, and it's been really effective. So it's a good way, like a positive reinforcement system. And I just thank some of these people for, Elizabeth Roof, she's helped me some bit with this, and Barbara Givler. Tyler Washburn is a colleague, and then actually Dr. Goresh as well. That was supposed to be on there, but she helped me a little bit with this too. So that's that. I don't know, are we good on time or? Okay, sure. Yeah, you want to shout? You're welcome. Mm-hmm. Sure. Do you have an example? Right. Right. Okay. You are. Yeah. Sure. So in your situation, was it, that might be, I just want to clear up. So it's kind of like your child's worked up and you're trying to remove attention so they can just calm down, right? Yeah, so just walk away. Like, don't say anything, don't do anything, keep an eye. So for safety reasons, you want to keep an eye. So if your focus is just that a lot of times when people are escalated and you start talking to them, it's going to escalate them more. We just want to keep that down. So a lot of times it's just the time. I know as people get into their kind of meltdowns and they hit a certain phase, it doesn't matter what you do. They have to run the course of the meltdown. And the more you intervene, the worse it's going to get. Like, think about it when you're worked up and somebody tries to rationalize with you, you just want to punch them. Our kids actually do punch us. It's the same thing. So, so just make sure your child's in a safe spot and literally just don't, because if you say I'm ignoring you, you're not. Yeah.
Okay, so I have a 13-year-old son, and I just want, my experience with the whole FBA, BCBA thing was that because I didn't know the terms to ask for, and this is just for the other parents who have younger kids, it took me 5 years to get a reasonable FBA. And then the BCBA, and then I had to actually literally take them to what I call school courts to get a BCBA to do the plan to carry it out. And even the follow through on it, the one thing I was going to ask a question about, so I guess what I'm trying to say is if you are wanting one of these in the school district, just use the term FBA and BCBA, otherwise you're not going to get either of those.
Yeah,
that's two different.
You're exactly right. I'm not surprised that's how long that took. That's part of the reason I want to get this information out, because I hear that way too often. Go ahead.
And it's so frustrating. And then regarding this, the gathering of the data, what I find is for my son and his age sees this as well, that there's typically a setting event, I didn't know what to call it until you said that sets him up for a terrible day. And so when they collect the data, the BCBA wants her to do the antecedent, but does not want her to put in anything that is further time-wise than a few minutes right before the event. So I find that to be limiting.
So
And I guess we'll be in time.
when you do take the data, you could see when I showed you the ABC chart, there was no room for setting events. A lot of my sheets, I'll have like a comment section on the side in case people want to add that. But they're definitely important to note, and possibly sharing this information that what we know about Prader-Willi syndrome is that those setting events are really, really a big piece of it. Yeah, it's hard because they occur so far in the future. Sometimes they could, or in the past, they could have been days prior.
Yeah.
But they're super important, so you do need to take that into account.
Just real quick, your deck is very useful and full of resources. Is it available anywhere?
I don't know.
Can you make it available somewhere?
This one. Yeah, sure. I don't, yeah, I think we're good. Yeah, right. There's also a blog that I've been doing for PWSA USA that is basically this presentation in short snippets. So I put one out that just explained this. So if you're, like, it's on their website. I don't know when the next one's coming out. It should be soon, I guess. But it'll be very similar information as well, so you can look out for that.
So we have a daughter, she's 12 years old, just started 7th grade. So she's been coming home crying a lot. And so is it appropriate for me to ask for an FBA? She holds it together at school, but when she gets home, she's starting to cry. She's let her grandmother know, I'm miserable.
Yeah.
I'm at a point now where I'm thinking, do we keep her in the school system?
Right.
But
That's difficult, so it's a good question. In order for an FBA to be done, there has to be an observable behavior to measure. So if there's no, it depends. So what I would do is, I don't know if you're talking to the school or if you've had meetings with them or if they're aware of this, but probably sit down first and talk and just say, there may be some behaviors that are happening in school that you don't know about that they may think are minor, but you can't really do an FBA if there's nothing to measure. So if all you're seeing is the crying when she gets home, I don't think an FBA is going to solve your problem, but I do think you need to look at and see if she can give you more specific information, sit down with the school, and talk about, what's going on. And then there might be something that comes up that you're like, oh, she doesn't do that behavior at home, or basically if a behavior is interfering with the student's ability to learn or participate in school activities or others, then that behavior could warrant an FBA. So if there is something that maybe it's taking her a long time to start her work, they could look at that, like avoiding of the work. But yeah, you're gonna have to dig a little bit more because they're gonna have something to measure.
We have time for one last question. If anyone, have we worn you out? Are you ready for lunch?
Cindy, that was amazing. Like everything
thank you.
you talked about is so helpful for families, and I think the hardest part as a mom is that you don't know all the background stuff that's happening in education, and so thanks for empowering us.
Oh, you're welcome.
Really good.
Thank you. Thank you all.
So thank you, Cindy, so much.
Okay.